Good evening, all. My name is Leon Carter. Today's date is September 1st, 2020. This will be our Unit 2 Case Connections video presentation. For the cases I picked cases number 3 and 2. Starting with case number 3, in this case, a 5-year-old infant is presented with frequent drowsiness, polyuria, and polydipsia. After running laboratory diagnostics for insulin measurements, we find that the patient's insulin levels do not react accordingly when blood glucose levels are increased. This implies that the patient's pancreas is not releasing adequate insulin as blood glucose increases. As a result, we can probably expect there to be some possible liver damage due to the excess production of glucokinase. Glucokinase makes the liver take in more glucose when there are high levels of it in the system. We can expect hexokinase levels to remain the same. With this information, we can assume that the patient's fasting blood levels are within the normal range simply because the patient is drinking so much water. The patient is naturally compensating for the high levels of glucose by consuming more water and means of excreting the excess glucose in his urine. Given the patient's age, we can narrow down our diagnosis with additional testing as this patient is displaying signs of type 1 diabetes mellitus, otherwise known as juvenile diabetes, where the pancreas is not adequately producing insulin as needed by the body. That concludes my response to case 3. Moving on to case 2. In case 2, we are presented with a MRI image as well as a PET image of the brain and a cancerous tumor located within the brain. Responding to a couple questions for this case. The first question asks us, how is glucose uptake regulated in the following tissues? The first tissue being the liver. In the liver, glucose uptake is regulated by elevated insulin concentrations and increased glucose concentration in the hepatic portal vein. Furthermore, glucose uptake is independent of insulin. However, since glucokinase has a high Km, then the concentration of glucose entering the liver increases, so does the rate of glucose 6-phosphate synthesis. For skeletal muscle and adipose tissue, glucose uptake is regulated by insulin. This tissue only uptakes blood glucose to any significant extent in the presence of the hormone. For the brain, glucose uptake is regulated by transporter GLUT1, which regulates glucose transport into and out of the brain across the blood-brain barrier. Next question, how does glucose uptake in normal tissue compared to glucose uptake by tumor cells in the attached image, and why would this be advantageous to the tumor? Just like many other bodily tissues, cancerous cells rely on glucose to function and proliferate. However, unlike normal body tissues, cancer cells are independent of glucose uptake regulators. Therefore, cancer cells freely and continuously take in glucose, thus fueling their multiplication process. In the image, this advantage, In the image, this is advantageous for the invasive tumor because In the image, this is advantageous for the invasive tumor because brain cells are fueled primarily by glucose, and the brain itself is rich with it. In the image, this is advantageous for the invasive tumor because brain cells are fueled primarily by glucose, and the brain itself is rich with glucose. The tumor cells are enriched with glucose, therefore they have a limitless supply of fuel for them to divide and multiply. These cancerous cells were initially influenced by the body's glucose uptake regulators, but then they mutated themselves to become independent and unaffected by these regulators, thus being able to freely multiply and divide. This concludes my case study 2 video attached to the script, you will find my reference page.